Hello, everyone. This is our final presentation for our accreditation plan for Puerto Rico's Department of Health. The presenters in this group are Mercedes, Abigail, Ariel, and Ryan. Puerto Rico's Department of Health has a focus on working for a healthier Puerto Rico. Their mission is to promote and preserve health as an essential condition for each human being to enjoy physical, emotional, and social well being. Puerto Rico's Department of Health is a government funded organization that focuses on ethics and new scientific discoveries to provide new and innovative ways to guarantee that all citizens have a right and access to the best possible healthcare and services. Currently, Puerto Rico's Department of Health has a high focus on access to health resources, quality of life, environmental health, infectious disease control, among others. Now, for a little bit of background on Puerto Rico, so we can better understand who their Department of Health serves and how their needs are specific to their community. Puerto Rico is a United States territory that is located in the Caribbean. According to the U.S. Census Bureau, about 3.2 million people live on the island, with over 98% of the population identifying as Hispanic or Latino. Puerto Rico has a history that is rooted in indigenous populations before Spanish colonialism in the late 1400s. In the early 1900s, Puerto Rico became a U.S. territory, and Puerto Ricans were granted U.S. citizenship. Under U.S. Protection as a U.S. territory, internal affairs are still ran by the local Puerto Rican government, but the United States does control many other aspects like military, foreign relationships, commerce, currency, among others. Being a U.S. territory, Puerto Rico's Department of Health is able to partner with local and federal government agencies like the CDC and branches under the CDC like the Office of Island Affairs. These organizations understand that being an island and a territory um, present Puerto Rico with special and different needs unlike mainland states.
As of May 4th, 2022, the date that the Puerto Rico Department of Health website was last updated, Puerto Rico is in the very early stages of the public health accreditation process. In partnership with members of their public health system in Puerto Rico, the Department of Health is in the process of conducting their state health assessment. The purpose of this assessment is to identify priorities, needs, and resources, educate and mobilize communities, and develop plans that assist in promoting health. They've completed the mobilizing for action through planning and partnership process. And in doing so, they have completed the 4 assessments that make up the MAP process. They've completed a community themes and strengths assessment, local public health system assessment, community health assessment, and forces of change assessment. The Community Health Status Assessment was completed by individuals from their Auxiliary Secretariat for Planning and Development. Sociodemographic and socioeconomic information, along with health resources available, quality of life, behavioral risk factors, environmental health, mental health, maternal and child health, and mortality were all assessed through this process. Unfortunately, at this point in time, our team has been unable to receive contact from the Puerto Rico Department of Health on their next steps in their accreditation process. We could speculate that they have spent a lot of time and resources on recovering from disasters, including natural disasters, and also the COVID-19 pandemic. We don't know that this is the situation, and is why they have delayed their accreditation process, but we can assume that such a small territory would have resources stretched more thin to deal with all of these extra situations.
After researching Puerto Rico, the social determinants of health that Puerto Rican citizens face, our group has identified 4 key areas of focus. The first key area of focus is chronic diseases. Heart disease, stroke, cancer, diabetes, asthma, arthritis, and Alzheimer's disease are the leading causes of disability and death in Puerto Rico. These chronic diseases are problems that are both common and costly to the population health. However, they are also preventable. The significant burden and prevalence of chronic diseases in Puerto Rico can be lessened by focusing public health efforts in primary prevention, early interventions, and disease management. Our second area of focus we identified is access to healthcare. While 90% of the people in Puerto Rico are insured, the Medicare programs in the mainland United States and Puerto Rico vary greatly. States receive open-ended federal funds to match a specified percentage of their expenditures for Medicaid-covered health services that their enrollees receive, whereas Puerto Rico only receives a fixed block grant funding amount each year. And this fixed block grant does not come close to covering the cost for Puerto Rican Medicare enrollees. And once this block grant fund has been completely exhausted, Puerto Rico must use its own funds to pay the remaining cost of Medicaid healthcare services. Our third area is COVID-19. Many communities have been hit hard by COVID-19, and Puerto Rico is no different. Because they have a large proportion of adults over 65 and they have a high prevalence of chronic diseases, much of their population has an increased risk of contracting COVID-19 and its harmful effects. Our fourth and last area of focus is emergency preparedness. Because of its unique location, Puerto Rico is subjected to natural disasters such as hurricanes, tropical storms, earthquakes, and tsunamis. When Hurricane Maria struck Puerto Rico in 2017, the entire country lost electricity, there was limited access to food and clean drinking water, and it also collapsed the country's healthcare system. The power outage and absence of a disaster management plan contributed to the deaths of over 3,000 individuals who experienced lack of access to medical care.
Our first area of focus is chronic diseases, with the initial goal being to establish an operational plan which will guide decision-making processes with strategies and priorities. The goal for chronic diseases would be to decrease the diagnoses of chronic diseases and to provide better management for those who are diagnosed with a chronic disease. This will be measured through health surveys and review of the data from various community partners regarding current policies, procedures, and healthcare resources that are being utilized. The goal for access to healthcare is to increase the number of residents in the community that have access to adequate healthcare. By providing more access to healthcare, individuals within communities of Puerto Rico have a higher chance of obtaining the highest standard of physical and mental health. This will be measured through surveys completed by patients who currently have access to different healthcare services. The goal for COVID-19 or any other type of epidemic is to promote and support evidence-based practices. The use of evidence-based practices increases the likelihood of cross-collaboration between different public health entities. The benefit of achieving this goal is to promote the quality, efficacy, and cost-effectiveness of disease interventions and reduce the likelihood of harm from disease. This will be measured through input and communication from the community and public health entities. Due to the higher chance of natural disasters occurring where Puerto Rico is located, overall improvement of natural disaster preparedness and awareness is needed. For example, individuals within communities need to have the proper education on what to do in certain situations, such as hurricanes or tsunamis. This will be measured by looking at the overall survival and mortality rates after a natural disaster and/or emergency situation occurs.
In the private sector, the Balanced Scorecard (BSC) approach to performance measurement complements the assessment of financial measures by adding 3 measures that evaluate intangible aspects of organizations. As discussed by Weir et al. 2009, the original framework can be adjusted slightly to more closely align with publicly funded organizations. The Institute for Clinical Evaluative Sciences, ICES, made adjustments to the original Balanced Scorecard specifically for public health programs, as these organizations differ from other healthcare organizations in their primary goal of prevention versus treatment. The 4 quadrants established by the ICES include health determinants and status, community engagement, resources and services, and integration and responsiveness. For the purpose of public health accreditation, the 4 quadrants recommended for use for the Puerto Rico Department of Health are those established by the ICES. Indicators for health determinants and health status quadrant will be indicators commonly found in public health community reports. Indicators will include chronic disease prevalence and morbidity and mortality related to disease, healthcare access, COVID-19, and disaster preparedness. This section will be used to confirm and outline the need for public health services in the community. Since there is a potential for a vast number of measures addressing social determinants of health and community health status, the Puerto Rico Department of Health is encouraged to select key indicators outlined on this slide as these reflect the biggest health issues in the community at this time. We recommend that a goal be to decrease spending on chronic diseases, including diabetes and heart disease. We'll measure the number of residents with a healthy BMI, and we'll recommend measuring a number of residents with a managed hemoglobin A1C, blood pressure, and cholesterol. We also recommend a goal of increasing the number of Puerto Ricans with medical insurance. This will help these individuals access health care that they need. We'll measure this by counting the number of residents with all types of medical insurance. We also will recommend a goal of increasing participation in natural disaster preparedness programs, and by doing this, we will measure the number of residents with preparedness plans for their homes. Community engagement is of critical importance when completing planning activities for public health departments. Mondal 2021 discusses the value of, quote, transparency, empowerment of community leaders, and multilingual education in successful interventions. To evaluate the level of community engagement, the Puerto Rico Department of Public Health should utilize satisfaction surveys and enrollment data for those utilizing their services and for those who are not. Puerto Rico Department of Health should also survey their community partners, including the United States government, to determine how they can better engage with the community to create value in the services provided. For the balanced scorecard for community engagement, we recommend a goal of increasing participation in chronic disease prevention programs. This should, in theory, help decrease chronic disease spending, which was a goal on the health determinants and status scorecard. We'll measure the participation in chronic disease prevention programs simply by following how many individuals participate in the National Diabetes Prevention Program. This program is put out by the CDC and helps individuals at high risk for diabetes to delay or prevent a diagnosis of diabetes. We'll also recommend a goal of decreasing the distance traveled to receive healthcare services. We can assess the distance required for travel via public transportation, safe roads, sidewalks, and biking trails. By focusing on the distance traveled to receive healthcare services, we may be able to address the lack of healthcare acceptance in Puerto Rico, and we may be able to bring services more closely to people where they need them. After understanding more about community engagement, the Puerto Rico Department of Health needs to address their resources and services provided. Weir et al. 2009 recommends assessing, quote, financial resources in terms of per capita and total costs, number of services, and staff allocated for these services. By understanding the funding and staffing of the Puerto Rico Department of Health, they can more accurately funnel these resources into the programming that best meets the needs of the community. Goals that we recommend regarding resources and services would be to decrease healthcare spending on key healthcare issues like chronic disease and COVID-19. We can assess dollars spent in Puerto Rican hospitals on the associated conditions. We also recommend developing emergency preparedness plans for health-related and natural disaster-related issues. By being prepared before these events happen, we may be able to respond more quickly and therefore save money. We can evaluate spending on the reactivity to urgent medical conditions. We would also want to establish an operational plan, and by doing so, we would draft this plan. We would also like to meet the needs of the community with human capital and financial funding currently available. To do this, we would survey community members to assess what programs they value and what services they would like offered, and compare that to the services and programs currently offered by the Department of Health. After understanding more about community engagement, the Puerto Rico Department of Health needs to address their resources and services provided. Weir et al. 2009 recommends assessing, quote, financial resources in terms of per capita and total costs, number of services, and staff allocated for these services. By understanding the funding and staffing of the Puerto Rico Department of Health, they can more accurately funnel these resources into the programming that best meets the needs of the community. Goals that we recommend regarding resources and services would be to decrease healthcare spending on key healthcare issues like chronic disease and COVID-19. We can assess dollars spent in Puerto Rican hospitals on the associated conditions. We also recommend developing emergency preparedness plans for health-related and natural disaster-related issues. By being prepared before these events happen, we may be able to respond more quickly and therefore save money. We can evaluate spending on the reactivity to urgent medical conditions. We would also want to establish an operational plan, and by doing so, we would draft this plan. We would also like to meet the needs of the community with human capital and financial funding currently available. To do this, we would survey community members to assess what programs they value and what services they would like offered, and compare that to the services and programs currently offered by the Department of Health.
The preliminary focus of the Puerto Rico Department of Health in regards to the 10 domains of the PHAB accreditation process should be Standard 1.1 and Standard 5.2.1a. Standard 1.1 refers to participating in or leading a collaborative process resulting in a comprehensive community health assessment. Currently, the Puerto Rico Department of Health is still in the early stages of conducting a community health assessment. Standard 5.2.1a refers to a collaborative process for developing the Community Health Improvement Plan. A Community Health Improvement Plan still needs to be created by the Puerto Rico Department of Health. These are both requirements for the PHAB accreditation process, making them crucial components on the path to becoming accredited. Because of Puerto Rico's unique location, they may be able to partner with online CEPH accredited programs that can provide additional support in creating and finalizing a community health assessment and community health improvement plan. Partnering with other organizations to help facilitate these requirements may help the Puerto Rico Department of Health focus on other needs of their community, while also providing experience for future workers in the field of public health.
The intervention strategy will first start with cross-collaboration to target different public health needs within Puerto Rico. The cross-collaboration is essential to involve different multi-sectors to build an accreditation team. This accreditation team will comprise of Puerto Rico's Public Health Department employees to provide insight on current battles within Puerto Rico's public health systems, the Office of Disease Prevention and Health Promotion to speak on these different intervention strategies to help prevent the progression of diseases, the National Center for Health Statistics to provide trends and current statistics on public health issues within Puerto Rico, the Office of Minority Health to ensure the healthcare services are reaching diverse populations within Puerto Rico. The intervention strategy team will work collectively to evaluate the health status of the territory by targeting the 4 areas of focus. As Puerto Rico does not have a community health intervention plan, the intervention strategy team can use this opportunity to create a community health intervention plan to target the 4 major public health areas, which include chronic diseases, access to healthcare, COVID-19, and emergency preparedness. Our final intervention strategy involves sharing our findings and recommendations with Puerto Rico's Public Health Department to ensure the importance of accreditation.
This is our reference slide, and the next slide is the references continue.